Hi everyone, and welcome to week 11 of the course. I hope you had a good spring break. So obviously things are very different from how they were just a few weeks ago, so I'll send out an announcement on Canvas. But as we adjust to this new situation, to this new class format, please reach out, be very communicative. I want to support you and for you to have fun in this class and learn things that are useful and interesting, not to stress or worry. So please reach out if you have any questions and we can talk about anything. So this week I'm very excited for the topic because this is one of my main focuses, natural language processing in healthcare. And today we're going to talk about how NLP can be used in healthcare, and then we're going to go through and do some actual activities of extracting information from free clinical text. So we've already talked several times in the past about some of the limitations of healthcare structured data. So data which comes from the EHR, which is input through forms or through structured input, like diagnosis codes, they're often incomplete. They don't paint a full picture, they lack detail, and they can also be inaccurate. So often clinicians turn to free text to record their full thoughts about a patient care and to document in much more and richer detail. So we saw this example in our earlier module on clinical data, and we saw that really valuable information can be contained in free text notes. So if you look at this, there's a lot of good info here. So we can see demographic data, the signs and symptoms, the diagnoses that a patient has, how they're being treated. But the challenge is that this data is unstructured. So while reading this means a lot to a human, it means inherently nothing to a computer. So there are a few different ways that you can get this data to be used. One is through manual review. And in this, you have experts who might be nurses or paid medical coders to read through patient charts in great detail. There's a lot of information in patient charts, and find the relevant information and put it into some structured computable format. So this is very effective because, human judgment is really ideal, but it's very expensive. It takes a long time, and it's not necessarily a very effective way of these domain experts' time. So it's slow and it's not very scalable. And once you start getting to look at populations of patients who might be in the millions, this really doesn't scale up to that. So NLP offers an alternative to this. So in NLP, you design a system to extract the information that you need. And what's good about this is that it can be scaled up to many documents. So you can run the same system across different patients, across time, and it's relatively little manual effort. Although, as we'll see later, it's certainly not no manual effort. NLP is very challenging and a lot of work goes into it. So a very high-level example of what clinical NLP might look like. So in this sentence, the patient presents with AFib and possible pneumonia. What concepts would we be interested in extracting from this text? Well, one thing is that we see that there's a diagnosis here. The patient has atrial fibrillation, which is highlighted here in red. And they also have pneumonia. So we have these two diagnoses. So when we recognize this, we can pull this out of the text, and if you have a smart enough system, you can map this string of text AFib to an ICD-10 code, for example, which in this case would be I48.91. And we've talked about terminologies as that they give you this unambiguous, structured way of seeing data. So the other concept here is pneumonia, which would have this ICD-10 code. But I wanted to point out that there's also something important here, that it says possible pneumonia. So depending on what your task is, maybe what your task is you're billing Medicare for the conditions that a patient has. If the documentation says that it's possible pneumonia, then that's very different from a confirmed case. And so this is another bit of information that NLP would need to extract. So at a high level, there are two different types of NLP systems. The first is rule-based. And in rule-based NLP, human experts encode domain knowledge into computational rules. And this essentially replicates human knowledge. So there are a lot of advantages to this. So one is that you're utilizing expertise. So you can get really rich and sophisticated rules. And you can extract really specific information because you can have a human sit down and define exactly what it is you're looking for. You can also really easily fine-tune and modify it. So if you find that one rule is maybe incomplete or doesn't work in a certain situation, you have some control over that and you can modify the way that it's extracting information. But there's certainly disadvantages to this as well. And one is that rule-based NLP is very time-consuming. You have to go through a lot of text, and you have to have a domain expert spend the time to go through and figure out exactly how to capture the information that you want. And sometimes this just won't work because sometimes the data is just too complex and the patterns just don't really lend themselves well to human encoded rules. The other kind of NLP system is statistical NLP. And this is essentially just machine learning. So we talked about machine learning in the last class, and in that we used examples of tabular data where we had rows which represented patients, and each column would be a different attribute about that patient. And in comparison to that, we would assign labels to say whether or not a patient had diabetes or cardiovascular disease. So in this we do the same thing, where the labels are assigned to the text based on what we want to extract. So the advantages here are that because you don't need to hand code the rules, in some ways this might be a lot faster. Your model learns straight from the data, which means that you don't have to spend the time figuring out how to capture this information if you can just provide the computer enough examples. But one big disadvantage of this is that it requires a lot of labeled data. And while we have a lot of data in healthcare, we don't have a lot of labeled data, which means that you have to go through and say, this is an example of AFib, pneumonia, heart attack. This is not an example, etc. Then once you train your model, it can't always be easily modified. So whereas with rules, you can really control the way that they're working in your data, in this, it's a black box. We talked about the black box problem with machine learning. You can't always interpret it, and you can't always change or control it when you find mistakes. So because of this, it's important to note that NLP is never perfect. And this is something that's really important to emphasize, especially if you're developing a product that uses NLP, because this kind of surprises users, because people talk about NLP like it's this magic process. But it's never perfect, and it's always going to make mistakes. So some of these mistakes come from maybe ambiguity, so a word might mean several different things. Really complex or unusual wording, which either your model didn't learn or you don't have a rule to extract. And one really annoying source of error is from typos. So if a person misspells a word, like infection, for example, a human might be able to quickly just see it and understand what it is, but to a computer, that's going to be something unrecognizable. So because of the mistakes that NLP makes, we need to evaluate how well our system does. So just like we did with our machine learning classifier, we evaluate NLP performance by using these metrics mainly: precision, recall, and F1. And just like with machine learning, there's always a precision recall trade-off. So if you remember, a precision tells you how many false positives you have in your predictions, times when you predicted that a concept was there when it wasn't. And a recall measures how many false negatives you have, how many cases are there that you missed. And it's always a trade-off, a balance between those. So you need to account for that depending on what the purpose of your model is. So how can NLP be used in the real world? Well, there are a lot of applications to healthcare, which is why NLP is such a rich and vital field to work in. So just a few examples. One is in research. So when doing a clinical trial, you might need to know which patients should be considered to be a part of this trial. Well, NLP can go through a patient chart, identify information about them, which may either meet or not meet the inclusion criteria for that study. For patient safety, this can be really important. So we talked about patient safety way at the beginning of this class. NLP can be used to detect or measure adverse events. So like when there's an overdose, like in the digital doctor, or when there's a side effect from a medication. In epidemiology, which is the study of diseases at a population level, you can use this for biosurveillance. So being able to quickly detect and track maybe new diseases or outbreaks of known diseases. And obviously this is very important right now because with coronavirus, it's across the entire world now. And there's a lot of information, and a lot of that is unstructured text. And one last application here is administrative. So we've talked in the past about how coders go through so that they can see what diagnoses a patient has or what procedures they had during their hospital stay. And that will be sent to either the insurance company or the government. So one example of this final use case is the company that I used to work at, which I've talked a bit about. They're called Help Fidelity, and they develop an NLP-assisted coding application. So what happens is that the NLP processes millions of notes from many different patients, and it extracts high-risk diagnoses. And these high-risk diagnoses include things like diabetes, congestive heart failure, Alzheimer's, conditions which really have a negative impact on patient care and are very expensive to treat. So the NLP identifies these, maps them to ICD-10 codes, and then these findings are presented to a human coder. Now the coder, instead of having to go through and read every line of the chart, they can just quickly scan and validate what the NLP is saying. Then this is sent, and the government, CMS, reimburses the payers for treating the patients for these diseases. And if you'd like to see one of their videos, which has some demo of this, here's a link to a video on YouTube.